This plate is reversible, and that one detail makes it two completely different adaptive tools in one. Let me show you why this is one of my most recommended mealtime products at askSAMIE. Hi, I'm Dr. Brandy Archie, occupational therapist and founder at askSAMIE, where we are helping to make everyday tasks safer and easier using occupational therapy approved tools. Okay, so this is a stay and eat plate. It's really cool because it has two different sides, two different purposes. So here you got a divided plate to help you with scooping food because you have a wall to hit things on. And on this side, it's actually sloped. So once you put it down on the table, it has this great rim, but not like your typical suction that you see on kids' plates, which I love because it gives you the dignity of like having a grown-up plate, right? And if the red is too much, it does also come in white. But this ridge actually does suction. So you put it on the plate, on the table, excuse me, and it's pretty okay just like that. But as soon as you push in the middle of it, it's not going anywhere. I literally have to do that to get it off of here. So that means it's staying put whether you have tremors or not, or whatever you're doing that might make the plate move. So you put it on here, we suction it down, push in the middle here, and then we've got these three divided areas so we can scoop a little bit easier on this side, which is really helpful if you have tremors. But then on the other side, if you have it sloping so that the food's coming down towards you, you kind of get this bowl effect without having a bowl. So one hand can then scoop things up into your mouth a lot easier than trying to chase things around a flat plate. So this is a great device because it has so many uses for multiple people. Even the red of this is helpful because red plateware has been proven to help people with dementia eat about 30% more than they usually do if they're often getting distracted. So it has a lot of major benefits in a lot of different ways in one simple tool. What I love about the stay and eat plate as an OT is that it meets the people where they're at. Flip it one way and you've got a divided suction lock plate that stays put even when tremors or with limited coordination. And then flip it the other way and you have this slope and scoop dish that's built specifically for one-handed eating, maybe after a stroke or if there's limited grip. BPA free, dishwasher safe, comes in red or white, and that color contrast is actually clinically meaningful to people with low vision and dementia. This is a $35 tool that can completely change what mealtime looks and feels like, and it is linked in the description below. Find it at askSAMIE and then share this video with someone who needs it.